Did you know that one-size-fits-all vitamin D recommendations are totally wrong for weight loss? I'm going to tell you why. There's a gene called the vitamin D receptor, the VDR, and it turns out that people that have a variant of this gene that doesn't bind vitamin D as well have a harder time losing weight at what are considered normal vitamin D concentrations. But if you increase their vitamin D level about 65%, many of these people have a much easier time losing weight. There was actually a study that looked at this. So that's why making one-size-fits-all recommendations when it comes to weight loss is totally wrong, because knowing our genetics can really empower us to know what is going to be right for us and what's going to get us to the body composition that we want without struggling. Have you been told that your seasonal depression could be secondary to low vitamin D levels by your doctor, and you've tried taking normal doses of vitamin D, but your vitamin D levels don't budge? It could be that you have a gene called the GC gene. This gene transports vitamin D, and people that have a certain variant of this gene have a much harder time absorbing vitamin D and need to be at much higher doses of vitamin D in order to get normal blood levels. So this is really different than the vitamin D receptor we talked about. That has to do with vitamin D binding to a receptor. This one has to do with vitamin D absorbing and being transported from your gut. What can help this is also vitamin K2. It can help the absorption of vitamin D when you have the GC gene. Do you know your vitamin D genetics? Comment GC to find out more. Did you have low vitamin D levels and you were given a prescription vitamin D, but you didn't feel any better? It could be because you had the CYP2R1 gene. Many prescription vitamin Ds are actually vitamin D2 and are not accompanied by K2, which is what helps you absorb vitamin D. So the best absorbed vitamin D is actually vitamin D3 with K2, but also there's a subset of people who have an issue with this gene CYP2R1 that can't convert vitamin D2, which is a lot of times what the prescriptions are, to vitamin D3, which is what your body actually uses. So it's really important to know your genetics and know the right kind of vitamin D to take. Most everybody will do okay taking vitamin D3 with K2. This has been Dr. Emmy.